Now let's look at the drugs that are used in the treatment of cough. Now, what is cough? Cough is basically a protective reflex which is manifested as a short, explosive expulsion of air which is intended to remove the irritants and accumulated secretions from the respiratory passages. Now, when we hear the word cough, we think it's a bad thing because it irritates us when we have a cold or a sore throat, but actually it's protective. It is regulated by a center in the medulla. Now, there are two types of cough. One is non-productive and the other is productive. The non-productive one is also known as dry cough. Now, the dry cough, it needs to be suppressed because it's not protective, it's doing nothing, it's just irritating the patient. It can be because of many drugs such as ACE inhibitors, while the productive cough is due to throat infections, etc. The non-productive should be suppressed while the productive should not be. Why? Because the cough allows the sputum that is produced in the airways to be coughed out and spitted out, otherwise it will lead to infections. We suppress the non-productive cough by giving them centrally acting drugs such as antitussives to centrally depress the cough center to stop the cough, and the productive ones are the productive cough is suppressed by locally acting drugs. The non-productive cough, as I said, is suppressed by antitussives, while the productive cough is suppressed by pharyngeal demulcents, expectorants, and mucolytics. Let's see what sort of antitussives we use. Now, antitussives, first of all, they inhibit the cough reflex by suppressing the cough center in the medulla, and thus they help in the symptomatic treatment of dry cough. They should not be given in children less than 1 year. Now, the different drugs involved in non-productive antitussives used in the non-productive cough, are codeine, folcodeine, noscapine, dextromethorphan, and antihistamines. Now, the codeine, it is a centrally acting cough suppressant. It can cause drowsiness because it's centrally depressing, cause constipation. Its addiction liability is less than that of morphine. It also has mild analgesia. It should not be given to asthmatics because you don't want to interfere with anything in asthmatics because you don't know what might trigger the asthma attack. The next one is folcodeine. It is longer acting than codeine and it has no analgesia or addiction ability. Noscapine is potent and it is an opium alkaloid, so it should not be given in asthmatics because they can be triggered. It causes bronchospasm. It has no analgesia, addiction, or CNS depression effects. The next, dextromethorphan, is also a centrally acting antitussive agent and it can cause sedation and hallucinations. It doesn't have any addiction or constipation. The antihistamines cause sedation, as well as they are antihistamines, so they're anti-allergic and antimuscarinic. Let's see the pharyngeal demulcents now, which are used in the productive cough. Pharyngeal demulcents such as syrups, lozenges, or linctuses can be used. What they do is that they increase the salivation and produce a soothing effect. What is syrup? It is a concentrated solution of sugar containing the drug. Lozenge is a solid dosage of the same thing, which is sucked and slowly liberates the active ingredient. A linctus is a viscous liquid. It is sipped slowly to allow it to soothe the throat. The expectorants now, what are they? They are mucokinetics, that is, they let the mucus flow. How do they do that? They decrease the viscosity of the mucus and the cough becomes less tiring. Thirdly, there are mucolytics. Mucolytics, they are mainly the two drugs as mucolytics are bromohexine and acetylcysteine and carbocysteine. Bromohexine is a semi-synthetic drug. It is both mucolytic and kinetic. It liberates lysosomal enzymes which digests or depolymerizes the mucopolysaccharides and decreases the viscosity of sputum. It can cause lacrimation and rhinorrhea. Acetylcysteine and carbocysteine are used as aerosols and they decrease the sputum viscosity as well. Their side effects are peptic ulcer and bronchospasm.